Universal access is front and center to the work we do at WHO. Achieving universal access is going to mean revitalizing virtually whole health systems in some developing countries. That sounds like an enormous undertaking, but it is achievable if there's political will and if member states work together. WHO thinks that we can be of most help to countries by focusing on 5 strategic priorities. And these are scaling up HIV testing and counseling, maximizing HIV prevention, accelerating treatment scale-up, strengthening health systems, and investing in strategic information. WHO is ready to partner with donor countries, national governments, and civil society to make universal access a reality.
An estimated 90% of the people living with HIV in the world do not know that they are infected. The benefits of knowing your HIV status are clear. People who test HIV positive can begin treatment before becoming seriously ill and can also prevent further transmission to others. Those who are HIV negative can benefit from counseling to stay uninfected. WHO assists countries to implement comprehensive programs that are based on best practice and the HIV testing and counseling principles of the 3 C's: consent, confidentiality, and counseling, all of which should be respected. A major focus of WHO's work is to help develop prevention services that adequately address the different modes of HIV transmission. Sexual transmission accounts for more than 80% of the infection worldwide, while injecting drug use drives more than 70% of the transmissions in regions like Eastern Europe and Central Asia. Access to effective prevention services is still limited. In many countries, HIV transmission from mothers to children is, for example, almost entirely preventable and has been virtually eliminated in high-income countries. But in developing countries, only 9% of pregnant women were offered prevention of mother-to-child transmission services in 2005. WHO is working to accelerate prevention efforts worldwide, and tools and approaches to guide countries in potential applications of innovative prevention strategies such as male circumcision, microbicides, and vaccines for HIV. The WHO-UNAIDS initiative to increase access to antiretroviral therapy in low- and middle-income countries has helped increase coverage in the past 2 years, but still only a minority of people who need antiretroviral treatment in developing countries have access to it. Estimates suggest that only 4% of adults and 1% of children living with HIV receive cotrimoxazole, an inexpensive and highly effective treatment for HIV-related opportunistic infections. WHO continues to provide assistance to countries to increase their capacity to provide quality treatment, manage drug supplies, and help them buy drugs at the lowest possible prices. The poor state of health systems in many developing countries is one of the greatest barriers to achieving universal access. WHO estimates that 57 developing countries have critical shortages of health workforce. The greatest shortfall is in sub-Saharan Africa. To compound the problem, many health workers are also dying of AIDS. Approximately 17% of the health workers in Botswana died of HIV and AIDS between 1999 and 2005. WHO is working with partners to develop an AIDS and health workforce plan to treat, train, and retain health workers in countries with high HIV prevalence. WHO is also supporting countries with an essential and simplified package of HIV/AIDS services that can be scaled up in the most resource-limited settings. Countries need to have comprehensive surveillance and data collection systems to appropriately estimate the burden of HIV/AIDS and to measure the impact of ongoing programs. Yet the quality of surveillance systems varies widely, and some countries still struggle to provide the most basic data. WHO is working with national ministries to strengthen strategic information, surveillance, monitoring, and evaluation. It will also be supporting country efforts to periodically assess and report on health sectors' progress towards universal access. WHO's 5 strategic directions each represent a critical area in the health sector response to AIDS. They also acknowledge the importance of focusing on WHO's efforts on strategies in areas of the organization where there is a comparative advantage and where there is sound evidence that a significant impact can be achieved. The AIDS crisis has developed so quickly in large part because of the weaknesses of the healthcare and education systems in many countries. But AIDS can also provide us with an opportunity to confront those issues head-on, undertake the difficult and often postponed work of building and rebuilding these systems for people in need, and to begin the long process of turning back not only the AIDS epidemic, but other diseases and injustices. This effort is vital, and there has never been a better time to do it than today.